Hello, and welcome to today's webinar, Give It Your Best Shot, talking to parents about the HPV vaccine. My name is Emily Haines, and I'm the Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for joining us today. Okay. So the planners and speakers do not have any conflicts of interest to disclose. Our goals for today are to review HPV cancers and the preventive vaccine. We'll also discuss reasons why parents aren't vaccinating and how you can recommend the HPV vaccine to parents and answer their questions effectively. After attending the program today, we'll hope that 75% of attendees will report that they are better able to discuss the HPV vaccine with parents in a way so that a strong recommendation for vaccination is communicated. In order to receive the contact hour, nurses must be present for the full program and submit a completed program evaluation. Those will be emailed to you following the webinar. Today's webinar is being recorded. If you have questions, we'll discuss those at the end. And you can put your questions into the questions area of your webinar. So let's start with a real life situation. You're actually going to be a participant in this vignette. I'm going to be Lisa's mother and you're going to be the nurse. So I'll read the mom's lines and then I'll give you a chance to read the nurse's lines aloud. When you've finished, type a Y into the chat box, and that way I'll know to go ahead and read the next line. So Lisa and her mother are in an exam room waiting for Nurse Williams. I'm sure the nurse will be in soon. Oh, here she is. Hi, Nurse Williams. It's good to see you again. Okay. Tell me about it. 11 years old and here for her annual checkup. So what's on the agenda for today? Does she really need all of those today? I think we might skip the HPV vaccine. So was this a strong recommendation for HPV vaccine by the nurse? If you thought it was strong, you can type a Y into the chat box. If you did not think it was a strong recommendation, type an N. And if you are not sure, you can type a U for unsure. Okay, so for those of you that answered no, what made you think that it's not a strong recommendation? Again, you can type those answers into the chat box and your answers will only be seen by me. They're anonymous. Okay, so that's right. It was not a strong recommendation by the nurse for HPV vaccine. Some people are saying that the nurse said could also. It's not really strong. The nurse could have been more persuasive. She made it sound optional. And that's right. It's important to know that the way you discuss this vaccine with parents will have an impact on whether or not children get vaccinated. So now I'd like to get a feel for what your experience has been like in discussing this vaccine with parents. Again, no one can see your responses. How comfortable do you feel discussing the HPV vaccine with parents? Let's say that 1 is not comfortable at all and 10 is extremely comfortable. Where would you say you are right now? And go ahead and put your answer in the chat box. Okay, so I'm seeing a pretty wide range of responses. We have all the way from 1 to 10. So what about your confidence level in your recommendation? How confident are you that your recommendation to parents about this vaccine is an effective one? 1 being not confident at all and 10 being very confident. Okay, good. So some of you are feeling pretty confident. I have some 10s, and then I see some that are lower on the spectrum and a little bit lower than the comfort level. And so that's not uncommon with this vaccine. We do see that nurses and physicians often cite discomfort with talking about this vaccine as a reason why they're not recommending it or why they might be providing a poor recommendation. Research actually shows that about 59% of physicians use a risk-based approach to recommending the HPV vaccine, and that's really not an effective practice. The reason being is that you really can't tell from looking at a child whether or not they are sexually active or whether or not they might become sexually active before they're in for their next annual appointment. And the other reason is that if a child's not sexually active yet, that's the perfect time to vaccinate them with for HPV. The vaccine will be much more effective if given prior to sexual activity. So this really should be a universal recommendation at ages 11 or 12. How you talk about this vaccine will have an impact on the parent one way or the other. So a really effective recommendation can support their decision to protect their child from cancers. An ineffective recommendation or no recommendation at all could unintentionally reinforce misinformation that the parents have heard about this vaccine or reinforce any hesitations that they might have. A study in the American Journal of Public Health in 2013 revealed that a strong healthcare provider recommendation for HPV vaccination increased parental acceptance by 4 to 5 times. So let's take a look at some reasons that parents don't vaccinate for HPV. The top 2 reasons are lack of knowledge and that it was not recommended. And these really can be addressed by effectively recommending the vaccine and answering any questions that parents might have. I really think that nurses are in a unique position to change the life of a child by protecting them from cancer through recommending this vaccine to parents effectively. If you go down the list, you'll see that not needed or necessary is another reason that parents cite. And what comes to mind for me is parents of boys often think that this vaccine is not necessary for their child because they associate HPV with cervical cancer, not realizing that oropharyngeal cancers have actually surpassed cervical cancers as the most HPV-related cancer, and that HPV vaccine is really recommended for both boys and girls. Reports from the CDC have shown that addressing these knowledge gaps with parents in combination with improving your recommendation for this vaccine are both critical to protecting teens from cancer. So let's just take a few minutes to review the diseases caused by HPV and how the vaccine works to prevent them. Human papillomavirus, or HPV, infects about 79 million people currently in the United States. By age 50, at least 80% of women will have acquired genital HPV infection. Almost everyone will be exposed through some type of sexual activity to HPV, and many will be infected, though they may not even know it, because most people have no symptoms of HPV. HPV can be transmitted through any type of intimate contact, so that means intercourse, oral sex, and some studies are even looking at it being transmitted through saliva. It is most common in late teens and early 20s. 90% of those infected will clear the infection on their own in about 2 years' time. However, when HPV infection does not go away, it can cause problems like cancer and genital warts. The cancers that are caused by HPV often take decades after the initial infection to develop. So as you take a look at this chart of cancers attributed to HPV infections in the United States, you'll see there are 4 known types of cancers that men get from HPV: cancers of the penis, anus, rectum, and oral pharynx. There's also 6 types of cancers that women get, cervical cancer being the most prominent, also cancers of the vagina, vulva, anus, rectum, and oral pharynx. So both men and women can get oral cancers caused by HPV. Each year, about 34,000 cases of cancer in the US are caused by HPV, so that's about 1 person every 20 minutes. Over 90% of these cancers can be prevented by HPV vaccination prior to initiation of sexual activity. So you can look here at the chart. We have the deeper blue is cancers caused by types 16 and 18. And then the lighter blue is the additional cancers caused by the HPV types in the 9-valent vaccine. And I just want to repeat that for people that are looking at this chart of cases in the United States. Over 90% of these cancers could be prevented with a strong vaccination program. And studies have shown that parents have been influenced to vaccinate their child because HPV vaccine prevents cancer. So cervical cancer is really the most common HPV-associated cancer among women and occurs most often in women over the age of 30. I really like this infographic from the CDC, which points out that tip of the iceberg. So yes, cervical cancer, most people will associate with HPV. However, there's about 300,000 high-grade cervical lesions per year in the United States that could also be prevented with HPV vaccination. Each year, there's about 12,000 women who are diagnosed with cervical cancer, and of those women, about 4,000 of them will die from cervical cancer in the United States alone. And then I'd also like to point out here on the bottom of the infographic, we have these other types of cancers that could be prevented through HPV vaccination. So right now I'm going to play a short clip from the documentary Someone You Love, the HPV Epidemic.
Kelly Pizzoli is a school teacher who is newly married to an officer in the U.S. Army. She was excited about her future until she was suddenly given a shock of a lifetime.
2.5 months ago, I had plans, and I was, moving back to St. Louis temporarily, like for the holidays, to spend with my family, and then off to Chicago. I was going to coach trapeze again, and I was going to be living in a city that I love with the friends that I love. Literally 5 days before I was moving back to Chicago, I found out that I might have cancer, and so I didn't go to Chicago. I'm 31, living at home again with my dad. It's surreal. Now that I'm starting to not feel as wonderful, he's been really great. Like he does so much for me.
She helps more than I help her. It's all her. It's all gymnastics champions.
I was a really athletic kid, and I played volleyball and softball and basketball, and I was always a gymnast, and I was a swimmer for a while.
She never had dreams of the Olympics. It was just fun. She loved doing it. She really did. She was good too. I shouldn't brag, but she was good. Obviously, I was there till 3 or 4 nights a week sometimes. Right after school, she'd come home, do her homework, get ready, we'd go to the gym, stay there for 3 or 4 hours.
In 2005, I got into trapeze, and I love it. And that's what I want to be doing right now. I don't know that I'll ever live in Chicago again, and I don't know that I'll have the opportunity to coach trapeze. I was getting my pap smears regularly. I had a doctor inside me with a speculum 3 times in the year preceding my diagnosis, and she didn't see it. It's scary. I was doing all the right things, and I was, going to the doctor as I should and getting all the screenings and doing all of that to the T. And then all of a sudden I have a 4.6 centimeter tumor hanging into my vagina. And yeah, okay, I have HPV, but that's going to go away because I had cleared it once before. It was back. I was like, okay, well, I'm going to clear it like I did before. And then I went in for a follow-up, and it wasn't okay.
She knows everything about what's wrong with her. She speaks to the doctors on a one-on-one basis. She knows the terminology.
Unfortunately, in Kelly's case, it appears to be aggressive and rapidly growing just based on what we're seeing. Apparently, it was not there 3 months ago. Now it is.
It doesn't make any sense. I was literally laying on the table flabbergasted when this doctor said that she saw a mass on my cervix. What? No, there's no way. It's not cancer because cancer doesn't grow that fast. Well, it was cancer.
So Kelly was a young woman who received an advanced cervical cancer diagnosis. What are your reactions to this video? You could type them into the chat box if you had any reactions you'd like to share with me. Okay, so some of you thought the video was sad and shocking. I would agree. This is a really powerful video, and Kelly was an advocate for her health, but she could have been spared cancer had she been vaccinated for HPV. To me, this is one of the most important recommendations that we can make to parents of adolescents to prevent them from going through a tragedy like Kelly suffered. So as we think about preventing tragedies for families, we look at the vaccine that we have available to prevent HPV infection. Another reaction that we got was that someone was wondering if testing was just the PAP or did it include HPV testing. And really in the documentary in Kelly's case, I don't know if she received HPV testing as well. She was over the age of 30, which is when co-testing is recommended. However, this was, I believe, before that recommendation became universal. So most likely she did not receive HPV co-testing at age 30 along with her pap smear. So now let's take a look at the vaccine that we have to prevent HPV. We're really going to focus on the 9-valent vaccine since that is what is most widely used in the United States. There are more than 100 strains of human papillomavirus. However, there are 9 types included in the 9-valent. So we have types 6 and 11, which are responsible for genital warts in both boys and girls. We have types 16 and 18, which are really the high-risk types of HPV. Those 2 types alone are responsible for over 66% of cervical cancers. And what's really not reflected in this graph, although it's a good one, it does not show that type 16 is also high risk for oral cancers. So about 70% of oral cancers are attributed to HPV and could also be prevented. Types 31, 33, 45, 52, and 58, those additional 5 types that are included in the 9-valent are responsible for another 15% of cervical cancers. So you can see that the 9-valent vaccine really offers a broad range of effective prevention for cancers in both boys and girls. when a child receives this vaccine early, the better protected they are from cancers. So think about the adolescents that you've worked with or that you might know. I'm curious, what age do you think that they're starting sexual activity? You can type your guesses into the chat box. Okay, so we have ranges from 9 through 16. And those are good guesses. When looking at graphs of sexual intercourse initiation, we really see a steady and dramatic increase starting at age 14 and 15. And remember, that's for sexual intercourse, not just, other types of sexual activity like oral sex and intimate touching, in which HPV infection could be transferred. So what's really important to understand is that HPV vaccine is inactive against previously acquired HPV strains. This vaccine's approved starting at age 9, so the earlier the better is really the key for HPV prevention. When we vaccinate earlier and definitely prior to the onset of sexual activity, we will be able to give our children the maximum protection against HPV-related cancers. Another benefit to vaccinating early is that they'll need less doses. And so only 2 doses are needed when the series is initiated prior to the child's 15th birthday. This is because they actually have a better immune response when the vaccine is given at that earlier age. When the vaccine series is initiated after the age of 15, that child will need 3 doses in order to get the same protection. Some teens will ask me if they should get vaccinated if they've already had sex. And the answer to that is yes. However, it might be a little less effective. So really, if they've already been infected with HPV or one of the strains, let's say they've been infected with type 16, then they won't get any benefit from the vaccine for that type. However, they will get some protection for any of the strains that they haven't been exposed to yet. So there is a benefit to vaccinating even if someone's already been sexually active. The way I like to think about it is like how we use seatbelts. So seatbelts really only work if you have them on before you get into a crash. We really want our teens to be protected long before they're ever exposed to HPV. So we want them to have their seatbelts on, but right after they get in the car. We don't want them to be waiting until after the crash to think about prevention. So let's do a seatbelt check in terms of HPV vaccination coverage on our New Jersey teens. We know that a little over half of female adolescents between the ages of 13 to 17 are up to date with HPV vaccination, and a little under half of males in that same age group are protected. So the goal is that by 2020, which is right around the corner for us, 80% of both males and females are up to date on their HPV vaccine series. We have a little ways to go. The number of adolescents who receive the first dose of HPV vaccine is actually a little bit lower in rural areas as compared to more urban areas. And what I see in doing work around HPV with pediatric and family practice offices is that a lot of offices think that they're doing better with HPV coverage, vaccination coverage, than they really are. So if you have access to your site's HPV vaccination coverage data, you could compare how your site's doing with the goals for Healthy People 2020. We've worked with sites over the years, and they think that they have high rates of compliance among their adolescent patients. But when we look at their data, we see that many of their teens are really not getting vaccinated until after age 13. They're not initiating the series until later. And NJIIS data really supports this as well. That's the New Jersey Immunization Information System. We see that New Jersey is really struggling to initiate at that 11 to 12-year-old age group. And we have some sites that are actually waiting until age 17 or 18 to begin the series, and they're seeing this as more of a pre-college shot than a pre-high school shot. And we really need to see this as more of a pre-sexual activity shot. So when we're waiting, we're not offering the best protection for our teens. So now we know why we want to be recommending HPV vaccination at ages 11 to 12, and this is one of the models for doing so effectively. So we have the recommend, ask, acknowledge, and advise model that was put forth through Vax Northwest in Seattle. And this model is really based on motivational interviewing techniques to use with parents around vaccine conversations. So the first step is to recommend the vaccine. You're going to use a presumptive recommendation that this is the norm. These are the vaccines that we expect our 11 to 12-year-old patients to receive, our Tdap, meningococcal, and HPV vaccines, as well as a flu shot during flu season. And we're going to ask about any concerns. The third step is to acknowledge the parent's viewpoint. So if they are accepting of the vaccination, that's great. You really want to support their acceptance of the vaccine and their choice to protect their child. If they have concerns or questions, you want to acknowledge that you're both wanting to keep their child safe and that that's why you're advising them to get their child vaccinated today. So addressing any specific concerns that the parent may have by offering your knowledge about the vaccine and about these cancers, you're advising why you think it's important. And I think that one thing we can use to be more powerful in our recommendation to parents is to use our personal beliefs. So I really would get my daughter vaccinated if she were this age to protect her from HPV cancers down the line. And we're going to talk through some scenarios later, and I'd like you to keep this model in mind because we're going to refer back to it. So this is really what a strong recommendation for HPV vaccination sounds like. It's given on the same day and in the same way that all other adolescent vaccines are recommended. So Sophia's due for 3 vaccines today. These will help protect her from meningitis, HPV cancers, and pertussis. We'll give those shots at the end of the visit. And when HPV vaccination is bundled with other adolescent vaccines and said in this way, it really comes across as a strong recommendation for the parents, and they're much more likely to accept it. Moms in focus groups actually who had not received a doctor's recommendation stated that they questioned why they had not been told about it or if the vaccine was really necessary if it wasn't brought up to them. So parents are really waiting for us to make a recommendation and discuss this vaccine with them. So when you bundle that recommendation, most parents will actually agree to it and you'll be able to go ahead and protect that child. Some parents might have questions even though they're interested in vaccinating. So I think it's really important that you interpret a question as natural caution and not a refusal. A question from a parent does not mean that they're going to wait until the next visit or that they're going to refuse that vaccine. It just means that they have questions. And so taking the time to really listen to parents' questions helps you give an effective response. I did provide a handout, and most of you should have received that a little before the webinar started. It's called Tips and Time Savers for Talking with Parents About HPV Vaccine. So these are just some takeaways from the handout. You can review that following the webinar. We really find that simple answers about cancer prevention work best when having this conversation. That's really the focus, cancer prevention. Making sure that parents know that HPV vaccine is needed to prevent HPV infection. There's no cure, and there's no treatment for infection other than that for genital warts. So infection is extremely common. Most people don't know that they have it, and they can pass it on to others, even if they've only had one sexual partner. I hear that sometimes from parents that, well, my child's not going to be sexually active until they are married or with one partner, and that really does, that will reduce the risk for HPV, but it doesn't eliminate it. So we really need to make sure that that child is also protected. Emphasizing a personal belief. So I would give my son or daughter the vaccine when they reach this age, or I've given this vaccine to my son or daughter. HPV vaccine is really safe and effective. Nearly 90 million doses have been administered in the United States since 2006, and there's been no serious side effects reported. So now we're going to go through some scenarios. And again, we want to keep that recommend, ask, acknowledge, and advise model in mind. So Taylor B is an 11-year-old female with a history of mild intermittent asthma who's otherwise healthy. She's in the office today for a well child checkup and to have a physical form filled out to start middle school. So the nurse says, Taylor needs 2 vaccines that are required for school, the meningitis vaccine and the tetanus, diphtheria, and whooping cough booster. We could also give her the HPV vaccine today. So is this effective or ineffective? You could type a E for effective or I for ineffective in your chat box. Okay, so most of you are identifying this as ineffective. For those of you that thought it was ineffective, what could the nurse say to make it more effective? So most of you are understanding that bundled recommendation is really more effective when we put HPV, Tdap, and meningococcal together. When we say that your child is due for 3 vaccines today, using that presumptive approach. So a more effective recommendation might sound like, today Taylor is due for 3 vaccines. They will protect her from cancers caused by HPV and infections causing meningitis, whooping cough, tetanus, and diphtheria. What questions do you have for me about these vaccines? So there's that recommend and ask part of the model that we discussed. It's really as simple as that. There's no need to bring up sexual activity or go into depth about HPV. Remember, part of the model is that parents, you're asking if they have any concerns. And so if they have those concerns, they will bring them up. The question is, if it's so easy, why aren't more parents vaccinating their child? And why are New Jersey rates so low? Remember, a good amount of nurses and physicians feel uncomfortable talking about this vaccine with parents. So to do this effectively, you really need to practice. I would recommend just starting with one patient, start with one parent, start with one family member or friend that you have knowledge that they have a child in that age group. Doing this will, over and over again, the more you practice, the more effective you will become in recommending this vaccine and discussing it with parents. All right, so we have another scenario here. Michael S. is an overweight 12-year-old male who comes to the office with his mother in late July for a sports physical so he can play football. He was last seen when he was 10 years old. The nurse recommended Tdap, HPV, and meningococcal vaccines, but Michael's mom has some concerns. So the nurse says, today Michael is due for 3 vaccines. They will protect him from cancers caused by HPV and infections causing meningitis, whooping cough, tetanus, and diphtheria. What questions do you have about these vaccines? And the parent says, oh, I don't think Michael needs the HPV vaccine. He's a boy. So we have that recommend and ask from the nurse. Very good on the part of this nurse. So the nurse's reply to the parents' concerns are, it's true, he can't get cervical cancer, but he could pass HPV on to his future partners. Was this effective or ineffective? If you thought it was an effective response to her concerns, you can put an E. If you thought it was ineffective, you could put an I. Okay, so citing that he could pass HPV on to his future partners, most of you thought was ineffective. What could the nurse say to make it more effective? You can type it into the chat box. Okay, so really focusing on the possibility of her son getting cancer, that it's protecting him, not just future partners, but also himself from getting cancer. So a more effective response might sound like, I understand, many parents initially feel that way. Unfortunately, HPV doesn't just cause cervical cancer. It also causes cancers of the mouth, penis, and anus, and genital warts. I want to make sure Michael is protected from these diseases. So we have that acknowledgement of the parent's concern, and then we're advising, I want to make sure that your child is protected. One question that we got was that I don't understand, or a comment that we don't understand how medical professionals or personnel are uncomfortable discussing this vaccine or this topic. And, you know, it really is common that nurses, physicians, front office staff, they don't always see their pediatric patients, and especially their younger pediatric patients. They're not seeing the consequences of HPV related cancer and infections. They are hesitant that parents will think that they're suggesting their child is sexually active at a younger age, and that the parent might be offended by that. So, you know, really they're focusing on the sex part of this vaccine rather than the cancer prevention part of it. And that's really the mind shift that we as a profession need to make. We need to shift away from this, you know, this is a sexually transmitted infection. Yes, that's correct. However, we're missing the key point that this is a way that we could prevent cancer. And if we use this vaccine effectively and we get our children protected prior to sexual activity, we can really do them such a service by reducing the risk for cancers later on in life. So we have this last scenario. Charlotte B is an 11-year-old female due for all 3 vaccines. Charlotte's father states that he has heard the HPV vaccine isn't safe. So the nurse's response to his concern is that all of those studies are made up. You can't believe what you read on the internet. So again, weigh in. Let me know if this was ineffective or effective in your chat box. Okay, so most of you found that dismissing what the dad had read on the internet was ineffective. What could have been said to be more effective as a response to his concerns about safety? And you can type that into the chat box. Okay, so if you feel as though Charlotte's father's concern, the nurse's response to Charlotte's father's concern of all of those studies are made up, you can't believe what you read on the internet, is ineffective or effective. You're going to want to just let us know if it was ineffective, what do you think they could do to make it a more effective response? So someone mentioned the 90 million doses that have been given without serious side effects, affirming that things are misleading, but describing the reduction of cancers. So providing some more information. And I'm so glad that you're mentioning the safety profile of this vaccine, which is very strong. And going back to that model of recommend, ask, acknowledge, and advise, we don't want to interpret a question about vaccine safety as a refusal. It's an opportunity to educate the parent and to give more information. So one way to be a little more effective would be to say, I've heard about those rumors too. I know you want to do everything you can to keep Charlotte safe, and so do I. So that's the acknowledgement part of his concern. The HPV vaccine has been carefully studied by medical and scientific experts, and it's been shown to be very effective and very safe. I've been giving this vaccine since 2006, and I don't have any concerns about safety, and that's why I'm comfortable giving it to Charlotte today. So really advising with a strong information base at the end too, by providing some more information about the safety profile of the vaccine. So I hope through practicing through some of these scenarios that you feel more confident and comfortable discussing this vaccine with parents. Let's just do another informal poll. How comfortable do you feel discussing this vaccine with parents? Again, 1 being not comfortable at all and 10 being extremely comfortable. What would you put in the chat box? Okay, great. So I'm seeing 10s, 9s, more comfortable than before. That's wonderful. These are some ideas that I'd like to share with you for being an HPV champion at your site. The idea of adopting a policy for HPV vaccination can really go a long way in an office setting, making sure that all of the office staff are aware of how important HPV vaccination is for our adolescent patients, making sure that anyone that's having patient contact understands how to discuss this vaccine with parents, that your office is dedicated to providing a strong recommendation for protecting adolescent patients, using presumptive messaging, so making this the norm. When you have an 11 or 12-year-old patient, oh, they're due for their meningococcal, HPV, and Tdap vaccines. That's just what it is in your practice. Avoiding missed opportunities to vaccinate. So if a child comes in, having some type of way to flag their chart, whether it's an EMR prompt, which I know many medical professionals feel is helpful in keeping up to date with vaccines, flagging their chart in some way so that you know to bring up that topic with that child and their parent so that that child's not leaving the office when they could have been protected. So I'm really interested to know, now that we've been able to practice this a little bit today, what would you say your commitment is to recommending HPV vaccine in this way in the next week or so, with 10 being I'm ready to go out and do this right now, and 1 being I don't think I'm going to be doing this anytime soon? All right, well, I feel like my job is done here. I've got all 10s coming in, so that's wonderful. I'm so glad to hear that you're committed to going out and using this language with the parents and patients that you're going to be interacting with in the upcoming weeks. And again, remember that, you know, having an effective conversation with parents is about being comfortable and confident and practicing. And you have the language, you have the tools here today. So please go out and practice this with your patients, and we'll do all the better for our New Jersey teens. So thank you so much for joining the webinar today, and we'll open it up for some questions in the chat box. Okay, Paul wants to ask a question.
So, although I'm not a nurse, having had the opportunity to be exposed to this particular information, I have a niece that's 13 and I have a nephew that's 12. And if I understood what you were saying in terms of the information, it would have been better if my niece would have been vaccinated already before she's 13. And my nephew is a prime candidate to be vaccinated right now. So my question to you is would I use this same strategy to have a conversation with their parents, even though I'm not a nurse? What are your thoughts about that, Emily?
So that's a really good question. So whether they're 12 or 13, it's really all about getting vaccinated prior to sexual activity. That's when you'll get the most protection. So the immune response is really strong for this vaccine up until age 15. It's still strong after that, but they'll just need those additional doses if they're initiating the series after age 15. So whether they're 12 or 13, they're going to have a strong response as long as they haven't initiated sexual activity yet. They'll still have a strong response, but they're not going to be protected if they've already been infected with one of the types. For talking with parents, I really just think that when I'm speaking with family members or friends about vaccines, whether it be HPV or other vaccines, I really just keep it simple. I vaccinate my child. That I want to do what's best for her, and that's why I vaccinate. I know that it's safe. I know that it's going to protect them from horrible diseases, and that's why I choose to vaccinate my child. And I really recommend that you vaccinate your child too. And really going back to that kind of personal belief or personal situation, I find to be really effective, especially if you know the person, because they most likely know your child as well. So, you know, they know that you wouldn't do anything to hurt your child, and that by vaccinating them, you're protecting them. So I find that to be really powerful.
That personal sort of appeal that you mentioned that nurses, as well as people who aren't nurses, could use.
Exactly.
Okay.
So one of the questions that we had come in is, what are the chances that HPV will ever be mandated for school? So there are some states that have mandated HPV vaccination for school entry. In New Jersey, I don't think that it's going to happen anytime soon. We do tend to have pushback in New Jersey for mandating vaccines. When flu vaccine became mandatory for children under the age of 59 months to attend childcare or preschool, there was pushback from parents just because it became mandatory. And so what we don't want to have happen is a backlash just because it's become mandatory. We don't want to see HPV vaccination rates go down. To be honest, New Jersey doesn't really have the room for our vaccination rates to go down for HPV. We need them to keep going up. So we really, thinking back to what parents are waiting for us to bring this up during an office visit, to bring this up when they're receiving education, when they're in there, they're interacting with a nurse or a physician. So that's, I think, what's going to drive the rates up, is us as medical professionals becoming more comfortable discussing this vaccine with parents and understanding that the earlier we vaccinate, the better. We're going to get maximum protection from cancer the earlier we vaccinate.
I'm curious in terms of when participants answered your question about how committed they were to do this. And as you said, you got all 10s basically in regard to that. And I'm wondering, for the folks who typed in 10 as that they were committed to doing this week, what is it that's causing them to be a 10 instead of, let's say, a 9? What caused their level of commitment to increase based on what they heard or talked about during the webinar? So if somebody could answer that or write that in, that would be great. we know it takes a little time to type answers in, so.
Okay, while we're waiting, I just want to point out, I do have some resources that I've shared here on your screen. The American Academy of Pediatrics has an HPV Champion Toolkit. There's also wonderful resources at the Children's Hospital of Philadelphia Vaccine Education Center. If you're really uncomfortable having this conversation, the Minnesota Department of Health has some vaccine videos for healthcare providers that play out the scenarios that we discussed today. And I also need to give a nod to the New Jersey Department of Health Vaccine Preventable Disease Program and the Protect Me with 3+ contest for middle school and high school students. That website is also translated into Spanish, and it has a parent tab, a student tab, and that of course has information about HPV vaccine targeted for both parents and children. So some of the responses for why people felt committed to discussing this is that they feel really comfortable with it, and they really just can make this a standard practice in their clinic. So I think that that's, you know, wonderful to hear that you're feeling confident and comfortable enough to just incorporate this into your practice and making this a norm that we do. And if everyone did that in New Jersey, we would really see our rates go up. Again, parents are just waiting for us to make that recommendation. So we can do them such a service, and we can do our children such a service by having that recommendation be an effective one.
This participant writes in that, you know, this is something that they do consistently in their clinic. And I'm curious what advice they may give to folks in other clinics where there are people that aren't really at a 10. So I'm wondering if that person could make any suggestions about, you know, how clinics could kind of adopt that just do it attitude and really help increase those rates in New Jersey.
Yeah, that would be great. We'd love to share those resources. One of the questions that came in is that since HPV vaccine is now available until the age of 40, in urban settings, there's a possibility that parent and child are eligible. Are there any materials developed for that recommendation? So in 2018, the FDA did approve HPV vaccination up until the age of 45 for males and females. Right now, the Advisory Committee of Immunization Practices, ACIP, is meeting this month, and that is one of the topics that they'll be discussing, is whether or not to incorporate that approval into the immunization schedule. Since it's not incorporated into the schedule and it's not a standard recommended vaccine for that age group, it does not need to be covered by insurance at this point. So right now, some insurances might cover it for up to age 45 and some might not. The standard recommendation, it goes up to age 26. So if a person is between the age of 9 to 26 and they have insurance, it's covered. If they're between the ages of 9 to 18 and they're eligible for the Vaccines for Children program, they're uninsured or underinsured, they could also receive HPV vaccine at no cost. For those that are in that older age group, it would depend on your insurance. So I think that what's smart is to hold off a little bit until we know whether or not it's going to be incorporated into the schedule before we make materials, because that would really change how someone might pay for the vaccine. And we want to make sure that we are giving the most updated information, but that determination should be made in the upcoming months. So we have one of the participants that said they make it a standard practice in their clinic, shared that they don't offer it, they just give it. They haven't had any parents refuse it. If any parent is doubtful, they discuss the vaccine, and they also provide the vaccine information statement before administering. which is wonderful. And it really goes with the research. That's consistent with research. So you're going to, introduce this vaccine as a normal vaccine that we give. You're bundling it with all the other vaccines at that age. And research shows most parents will accept that recommendation. They're just waiting for you to say it. And when you do, they will accept it. It's a very small amount of parents that will have questions or concerns. And again, those are just questions or concerns that you could address with some education. It does not mean that it's a refusal or that you need to wait until it's the next time that they come in. So I think that that's really a wonderful approach, and making it the norm is really the goal for New Jersey. So the question is, how does this discussion change about being vaccinated if it's the parent and child are eligible and not just the cost? So what I would say is that a child will get the maximum protection by being vaccinated now. If they're in that age range of 11 to 12 or prior to 15. I would say that this is really the time we recommend the vaccine because they get the maximum protection. The vaccine, if you haven't been vaccinated for HPV, you could also get vaccinated. At this time, I would say, check in with your provider. If I'm not that family, if I'm not the parent's provider, I would have them discuss it with their family practitioner first, to let them know that this may be available for you as well because it's recently been approved up to age 45. But I would really focus in for the parent on, this is a way you can protect your child. This is an opportunity that wasn't available for us at this age. And so this is such a gift that we can give to your child now, and giving them the maximum protection, that now is the time to protect your child. Okay, so before we close, I'd just like to remind you that in order to receive your credits, you'll receive your evaluation form. You just need to fill those in and email them back to me. The instructions will be on the evaluation form. And when you send in your completed evaluation form, we'll email you your certificate of completion. So thank you so much for attending the webinar today. And if you have any questions, my information is up on the screen and you can feel free to contact me. Thank you.